The following segment is sponsored by Intermountain Healthcare and the Utah Department of Health.
Yeah, we'll take the snow any way we can get it, I guess. It is time for Baby or Baby. I'm here with Nurse Katrina Jensen with Intermountain Moms, and today we're talking about ways to help teens take responsibility for their health, especially if they have some issues they need to know how to handle when they get out on their own when they're 18 years old or whatever.
Exactly, Ron. You know, we don't think about this too often, but as kids get in their latter years in high school, you know, junior and senior years, it is a really good idea and very important step for them to be aware of things like, do they take medications regularly? Do they have any surgical history? You know, did they have their tonsils out, their ears, etc.? So that, you know, as they get older, they can start taking some of the responsibility that the parents have been handling, such as calling to make their own appointment for their annual physical, being able to get through those phone trees when, you know, they're not that easy to do, you know, and
no,
kids,
it isn't. It can be frustrating sometimes. And
even as adults,
when they ask you
right?
a question, if you don't know the answer, it's like, well, I don't know. Yeah.
One of the other things is when you take your child, if you're still attending those pediatric or well child visits, have the young adult advocate for themselves. So make sure you're not answering all the questions. In other words, you know, when the provider is asking you questions, don't jump in there and answer for your child. Let your child start advocating for themselves. It's really important. Kids, I think verbal skills are not maybe as developed as they were possibly years ago with the phones and all the technology. They're used to a lot of nonverbal communication. Another thing that is really challenging is learning how to call your insurance company, or what is your insurance, you know, name, what does your policy cover, what kinds of basic things. It's pretty complicated for adults to understand insurance.
You know,
so
17, 18-year-old.
So doing it with your child, I think, is a great way to do this. You know, have them be with you when you're calling to check on a benefit or checking on deductibles, etc. I mean, it is something that they will need to be accountable for as they get older. And then finding an adult provider is something that a lot of people don't think about. If they're going to a pediatrician, it's important
it's time to transition to.
Yes, exactly. And be aware of insurance coverage and where do they live and where are they going to be living? Where is your young adult going to be living? Are they going to be living at home, etc.? So these are really just things to start thinking about.
A lot of parents probably haven't even thought of that yet.
I don't think so.
That is a great reminder or a heads up for all of us. Okay.
All right.
Katrina, thank you very much.
Ron.
Good stuff. Back to you, Mary.